Do you wake up more often at night just to use the bathroom? Have you noticed your urine stream is weaker than it used to be? Or do you feel your bladder never completely empties no matter how hard you try? These are not just normal signs of aging. They may be symptoms of an enlarged prostate. I'm Dr. Berman, and today we're going to talk about a condition that affects half of men over 60 and nearly 90% of men over 85. Benign Prostatic Hyperplasia, also called BPH, or simply prostate enlargement. In this video, you'll learn what the prostate is and why it grows with age, the most common warning signs, how doctors diagnose it, treatment options from lifestyle changes to advanced procedures, and what you can start doing today to protect your urinary health. By the end, you'll understand exactly what prostate enlargement means and how to take control of your health. The prostate is a small gland, about the size of a walnut, that sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. Its main job is to produce fluid that supports and protects male reproductive cells. As men age, the prostate undergoes hormonal changes. One of the key hormones involved is dihydrotestosterone, or DHT. DHT stimulates growth of prostate cells. Over time, this growth can cause the gland to enlarge. Now here's the important part. When the prostate grows, it doesn't expand outward. It squeezes inward on the urethra, like a hand pressing on a straw. That's why urination becomes difficult. This condition is not cancer. It's called benign prostatic hyperplasia. Benign means non-cancerous, but just because it's not cancer doesn't mean it's harmless. BPH can have a major impact on quality of life. So how do you know if you have an enlarged prostate? Doctors group the symptoms under lower urinary tract symptoms, or LUTS. Let's go through the most common ones. Frequent urination, especially at night. Waking up more than once or twice is a common sign. Urgency, the sudden strong feeling that you have to urinate immediately. Weak stream, the flow of urine is reduced, and it takes longer to empty the bladder. Difficulty starting urination. You stand at the toilet, but it takes time for urine to start. Dribbling. After finishing, urine continues to leak. Feeling of incomplete emptying, like your bladder is never fully clear. In more advanced cases, BPH can lead to bladder stones, urinary tract infections, even kidney damage if pressure backs up into the kidneys. If you notice these symptoms, don't ignore them. They are not just a normal part of aging. They are a medical condition with real solutions. How do doctors confirm BPH? Medical history and symptom score. Doctors often use a questionnaire called the International Prostate Symptom Score, IPSS. It asks about frequency, urgency, nocturia, and quality of life. Digital rectal exam, a physical exam where the doctor feels the prostate size and texture. Urine tests to rule out infection. Blood tests, including PSA, prostate-specific antigen. PSA is not specific for cancer alone. It can also rise with BPH. Ultrasound or flow studies, sometimes used to measure urine flow and how well the bladder empties. The goal is not just to measure the prostate size, but to understand how much it affects your daily life. The good news is, BPH has many treatment options. The right choice depends on how severe your symptoms are. 1. Watchful waiting, lifestyle changes. Reduce evening fluid intake. Limit caffeine and alcohol. Double voiding technique. Urinate, wait a few seconds, then try again. Regular physical activity. 2. Medications. Alpha blockers, like tamsulosin, relax muscles in the prostate and bladder neck. 5. Alpha reductase inhibitors, like finasteride, shrink the prostate over time. Sometimes both are used together for better results. 3. Minimally invasive procedures. Urolift, tiny implants that hold prostate tissue away from the urethra. Resume, water vapor therapy that destroys excess tissue. 4. Surgery. TURP, transurethral resection of the prostate, the gold standard procedure. Laser enucleation, newer methods using laser energy. Each approach has pros and cons, but the key is, there is no need to suffer in silence. There is a treatment tailored for every stage. Now let's spend some time talking about prevention and self-care. While we cannot completely stop the prostate from growing as men age, we can slow the process and reduce the severity of symptoms. Let me break it down step by step. 1. Nutrition and diet. Food plays a powerful role in prostate health. Studies suggest that diets rich in vegetables, fruits, whole grains, and healthy fats are associated with fewer urinary symptoms. Tomatoes are especially beneficial because they contain lycopene, an antioxidant that supports prostate tissue. Green vegetables like broccoli, Brussels sprouts, and kale contain compounds that may protect against cellular changes. Omega-3 fatty acids from fish like salmon help reduce inflammation. On the other hand, certain foods can make symptoms worse. Too much red meat, processed foods, or high-fat dairy. Caffeine and alcohol can irritate the bladder and increase urgency. Spicy foods may worsen nocturia in some men. So, eating with balance is key. 2. Physical activity. Exercise helps regulate hormones and reduces weight gain, both of which are linked to prostate enlargement. Aim for at least 150 minutes of moderate exercise per week, brisk walking, cycling, or swimming. Add pelvic floor exercises, Kegels, to strengthen the muscles that control urination. Even light stretching and yoga improve blood flow and reduce stress hormones. 3. Fluid management. Simple habits can make a big difference. Avoid drinking large amounts of fluid within 2 hours of bedtime. Spread water intake evenly throughout the day instead of drinking too much at once. Limit evening tea, coffee, or alcohol, which all increase nighttime urination. 4. Stress and sleep. Chronic stress increases cortisol, which disrupts hormone balance. Poor sleep also worsens urinary urgency. Practice relaxation, meditation, slow breathing, or light reading before bed. Keep a regular sleep schedule, going to bed and waking up at the same time daily. 5. Supplements and vitamins. Some men try natural supplements. Saw palmetto has been studied for decades, though results are mixed. Beta-sitosterol, a plant sterol, may improve flow. Zinc and vitamin D play roles in overall prostate health. Remember, always discuss supplements with your doctor. Not all are safe or effective. 6. Avoiding risk factors. Quit smoking. It damages blood vessels and worsens urinary flow. Limit alcohol. Manage chronic diseases like diabetes and hypertension as they worsen symptoms. Prevention is not about a single magic pill. It's about daily habits, small decisions, and consistency. As we reach the end, let's take a moment to summarize. Prostate enlargement, or BPH, is extremely common after 60. It causes symptoms like frequent urination, weak stream, and incomplete emptying. Diagnosis is simple, and treatments range from lifestyle changes to surgery. Most importantly, you do not need to suffer in silence. Think of this. One of my patients in his late 60s came to me after years of waking up 5 times a night. He thought it was just old age. After treatment, he now sleeps through the night and says he feels 10 years younger. This is not just about the prostate. It's about quality of life. It's about your energy, your sleep, your relationships, your confidence. So my advice, don't ignore the signs. Don't be embarrassed to talk to your doctor. And don't accept poor health as inevitable. Take action today, and your future self will thank you.